Is there anything you can do for a stretched out earlobe or stretched out earlobe piercing? Well, yes, there is. We perform earlobe repair in our office under local anesthesia all the time. We do a lot of earlobes. One category is patients who formerly wore gauges in their earlobes to stretch them out, the big disc. If you have gauges in place and if you would like to have a more normal appearing earlobe, we recommend that you remove the gauges and you give your earlobe about 6 months to contract. If you're left with a stretched out piercing or even, an empty kind of hoop-like tissue of your earlobe, we can do a tissue rearrangement and a reconstruction under local anesthesia. That will require making an incision, usually where your earlobe meets your face and possibly within the earlobe. And the goal is always to create symmetry of the earlobes and a more normal and natural look to the earlobe. And sometimes we can re-pierce the earlobe at the same procedure. Another common thing that we see is a stretched out ear piercing, either from wearing very heavy earrings for many years, or maybe there was trauma to the earlobe, like a dog jumping up or a child pulling on an earring. And patients who have a stretched out piercing say that they worry their earring is going to fall out, or it hangs very low and they feel like it contributes to a more aged appearance of their earlobe. So we definitely repair a lot of earlobes in the office under local anesthesia. Rather than just stitching up the bottom part of the piercing and leaving the top intact, we usually repair the entire piercing, the front and the back, and we can re-pierce the earlobe at the same procedure, usually just 1 millimeter over and sometimes a little bit higher. That procedure takes about 30 minutes or so, again awake under local anesthesia, and downtime is about a week before you're exercising.